So we will begin the Western Hampden County Public Health District Advisory Board meeting at 2:35 on Tuesday, December 10th. First wanted to start with our quarter 1 report, the financial report. The state is using a new system for reporting through Smartsheet. So our quarter 1s are actually being reported in 3 terms now. So for quarter 1 through June to October 31st, we spent about $80,000. So that's including salaries. So that's actually, we're really happy with that. And we're on track to spend all of the grant money on items and programs to help all of our towns. So I'm actually really happy with that number. Spending was mostly on trainings, health communication, supplies. We have a lot of brochures that we've bought and other supplies for our new parent program. So it has been a pretty good start to quarter 1. We're getting another lump sum of money from the state this month, so we'll be able to start our spending soon. Hopefully that's deposited in the next couple of weeks. Yeah, so that's kind of just a quick overview of the financial report.
Just to pause here.
Yes.
We don't have to vote, but we should do an attendance
Okay.
for minute purposes of
Okay.
everyone who's here.
So just like a everyone.
Everyone can just introduce themselves.
Okay. So should I do that now?
Yeah, might as well.
How do you even start that?
Okay. Sue Braska representing Southwick.
Okay.
Tom Hibber, Health Director for the town of Southwick.
Tricia Sudlow, public health nurse.
Kayleen Simons, Shared Service Coordinator.
And then if you want, oh,
Go ahead. Lane Britannico, Town of Russell.
Margaret McClellan, Town of Tolland.
Marianne Deming, public health nurse.
Jennifer?
Yeah, she said it.
Okay. Sorry, Jennifer.
Everyone.
Perfect. The next thing on the agenda would be the nursing reports. I sent those out in the recent email. Did anyone have any questions for either Marianne or Tricia? Okay. Anything you wanted to say?
You're gonna bring up the maternal program.
Yes.
First, but I don't have anything.
I can talk about that now if you want me to.
Perfect.
So the maternal program, we have started that. So we have our new brochure. I know, Sue, you wanted to see that.
Yeah.
So that's been printed, and we have sent that to Southwick residents who have had a baby within the last 6 months, I'd say. As well as we did get from Tolland that they do not have a lot of births every year, but she's happy to send information when she gets it to new parents so that we can start the program up there. I did send information to all the town clerks. We're looking for addresses, names, when if any of the babies have been born within the last 6 months. I haven't gotten any other responses besides Tolland and Southwick. So if you guys could just let your towns know that we're looking for that information and we really want to send these to all the towns, that would be great. Tricia and Marianne have both done training, so they're pretty ready to do this program. So hopefully we can get a household in the next couple of weeks.
So does this go in, sorry.
Okay.
Does this go in an envelope?
Yeah.
Okay, with an address.
Yeah.
Okay.
Yeah. So those are all, I think we sent about 22. So recent Southwick moms.
22.
So have you reached out to town clerks, or you've not reached out to town clerks?
I have. I sent an email last week looking for that information. So just if you could remind them that we're looking for that information. I've only received Tolland and Southwick so far.
Thank you.
One thing we did in Southwick, this is something that's within the scope of what the public health nurses do. But I think I don't want to speak for any other towns, but I think there was some hesitancy in Montgomery, being that the nurses aren't employees of that town, so they were not resistant to the idea, but they just kind of weren't 100% comfortable. Like, am I supposed to be sharing this information? Mm-hmm. So in Southwick at our last meeting, I just kind of brought it to the board and just had the board do a quick vote and just say, yeah, we support this program. I think that would, especially most of the towns, the Board of Health and the Select Board is the same board. So I think that would just kind of go a long way to legitimize it. And then it's, on the record and If the clerks had any question, it would be in the minutes and everything that, yeah, this is legit. It's legal. There's no violation of anyone's privacy, and the Board of Health and or the Select Board support it. So that way it would make things a little bit easier. And I don't know if that's a situation that we're running into in the other towns, but just to speak for Montgomery and Southwick.
Sure. That's pretty much all report on the new parent program that I had to share. Was I missing anything, Trisha?
Nope.
Okay.
I don't know.
Perfect.
Thank you.
And the nurses just finished up the training for it.
Yes.
Yep.
Yep.
So where was the training?
Online. It was
Okay.
by Brazelton Institute, Newborn Behavioral Observation. We had 3 classes in November. It's very interesting.
Oh, good.
Any questions on that? Or Mariana, if you have anything to share?
No, that's it. The training was really great, and we're kind of excited. We hope we get to do a visit pretty soon before we forget all the good stuff we learned.
Yes.
Hopefully
So how long ago did these go out in Southwick?
Friday?
Friday.
Oh, Friday.
Yeah.
Okay.
I mean, time of the year is not ideal with
Yeah.
the holidays, but hopefully someone will put
Yeah.
it aside and say, oh yeah, I gotta respond to that. So
Yeah.
Yeah, after we got the legal approval, I was just excited to
We
get
were
it out, and
excited
I didn't
to
really
send them.
think about it,
Yeah.
and that it was right before the holidays, but hopefully, we'll see.
Yeah.
Another thing, is there like a limit on the number of visits per household you would do?
we're saying 1, but I mean, there's nothing to say that if the family wants us to come back, be happy to. They have concerns or questions, so sure.
And how about if can they call you, or how does that work if they have?
Yeah, because are our numbers on the back or just
Yes.
yeah. I think in our email, just our number.
Yeah.
Yeah, is this are these your cell phone?
Yeah,
numbers?
that's all.
Okay.
Yeah.
So if they're uncomfortable with either of the nurses going to their house, possibly it could just be over the phone
Yeah.
was our hope.
Yeah.
Or
Do what they-
Or,
just depending on their needs.
or a Zoom or FaceTime.
Yeah, somewhere
sort of
else.
thing.
Yeah. Because I know that's probably sensitive as well.
Now, do you answer your phone 24/7 or?
No, only during business hours.
Okay.
Yeah. Hopefully they'll leave a message, right? I check my messages, so.
All right, so you know if it was an emergency. Hopefully they would call you with an emergency. Hopefully they would.
Yeah.
Yeah.
Hopefully not.
Call
Because
the
it's
doctor's
on
office.
there, it's just really talking about like the education, that kind of aspect, not so much the medical interventions. So that's hope. The next part of the agenda was just an update on the Western Hampden County Public Health District Google Drive. I did send a link in a few of the emails, and I'll also send the link in a follow-up email. But I did create a Google Drive just to link important documents, including agendas, minutes, the nurses' reports, and other documents, including the IMA and our work plan, just to make sure that you all have access to any important information as it changes, and then anything else I can add quickly. So I thought that would be helpful. That was just a quick thing that I wanted to make sure that you all were aware of. Pooling of the opioid abatement funds. We're still kind of waiting on this process. We do want to get the support from our town manager in Southwick, along with the fire department and the police chief. See the need within Southwick first, because I know we have to go to the select board for approval, get the accounting department. So once we get the approval from all of that, we'll work on the pooling of all the other towns, kind of coming into this one accounting, what do I want to call it? Fund? Yeah, one major fund. Marianne and I actually had an opportunity though to meet with Tapestry Health to discuss a partnership with them within our district. And we met with she was the director of harm reduction practices, who linked us with some numbers, and they will be happy to help us in creating some harm reduction practices with the pooling of the funds, or with the opioid funds themselves. So Tapestry offered to come out and empty sharps disposal boxes or Narcan boxes outside of any of our town halls if we wanted to create them. And she actually gave us the prices for those. So sharps disposal boxes to be put on any of the outside of our town halls or wherever any of the towns want to put them would be about $65 to $75 each, and Tapestry comes for free and empties those boxes. Narcan boxes outside of town halls are a little bit more expensive, ranging anywhere from 400 to 450, I want to say. Um, but we were talking with the harm reduction director, and we are going to see the need or want from the towns within our district just to make sure we can get her the correct number once we have the pools funded. So I just wanted to see what towns would be interested in the opportunity to have the partnership with Tapestry and have a sharps disposal box or a Narcan box outside of the town halls. I know that's kind of a big thing. It kind of would probably have to go through select boards and other approvals, but it is one of our work plan objectives. So we really want to do something with these opioid funds. And that was our major idea, is a sharps disposal box or the Narcan box.
What would be the total amount in the fund with all the towns?
So if each town was to do both a sharps disposal box and or how much does each town have, is your question?
Or how much altogether?
It was looking to be about 27, I want to say 27,000.
Yeah.
Granville had the most, then it was Southwick, and then some of the,
Yeah.
I believe, Wayne, you said that Russell has very little.
Yeah, like hundreds of dollars. Yeah, it's not much a lot.
Honestly,
That's what I was saying.
yeah, that's enough for a sharps disposal box, to be honest. So
Yeah.
every penny goes a long way.
How do they determine how much the towns get, each town gets?
I think part of it is based on population. It was a whole thing, but the towns, I think, had to sign up. Like they had to like sign on to the lawsuit at a certain time. So I think that Matt must have just been very proactive and knew the right places to look and signed on to all of the lawsuits, because I couldn't believe they got more than Southwick.
Yeah.
But because if it was purely based off population, then obviously Southwick would have got the most.
Yeah.
But I think Matt must have just been really proactive and made sure to sign on to everyone. And I wasn't in this position at that time, but I remember when I was in Westfield, I remember hearing about all the opioid funds and all the hoops you had to jump through, and it was confusing. Like,
yeah,
it wasn't just like, oh yeah, there was like every different drug maker, all the big companies, there was a different lawsuit. There's a CVS lawsuit. There's a what's
Walgreens, Walmart.
all the pharmacies, the big what's the ones that got in all the criminal trouble too? I can't even think of their name, but
yeah,
there was like at least 10 different funding sources.
So are you hoping to take that 20,000 and divide it between all the towns, or just use what each town has?
You pool it all together. So we'll have one account that will be like, it'll probably be called like the Western Hampden County opioid funds. And then that can, all that money can be used for all 6 towns to do. I think ideally they want you to do the same thing in every town, or share the resources to do the same thing in all 6 towns.
So each town has to agree to fund the money.
Yeah.
Each town yes.
Yeah.
So Southwick would have to start by approving it to allow the accounting department to put together the fund.
So
to put together
for towns that have a board of health and a select board, who decides, select board or the board of health?
I have to say both.
I think select board, because the money is not going through, the money is not going directly to the public health. I think it just goes right into, if I remember right, just goes into the general fund.
Yeah.
Right. Yeah, I think DPH's kind of dream scenario with suggesting that shared service arrangements like ourselves do this is because so many towns didn't get enough to do anything really significant with the outside of our shared service arrangement. If 3 towns wanted to pool their funds, they would have to create a board or committee with a representative from each town to decide how that money is spent. So I think DPH was kind of hoping, we have all these shared service arrangements that can be the venue for who decides how the money is spent. But that means each select board needs to kind of give that responsibility to this board.
Yeah. Yeah.
So
I'd be interested to see because, like I said, we're hundreds of dollars. I mean, it's not much at all. And so, if I don't know. You said Granville was the one that town that got the most out of.
yeah,
Yeah.
I know how would they feel about if they pull those funds, and so Russell gets a Narcan box and a Sharps container, but we only put in $300. I don't. They may not have an issue, they may not, or they may already have some plans for that. So that's something, like I said, it's going to have to go to the select board
yeah.
to
Yeah.
see it. I don't think there's going to be any. It's such a little amount on our side. I don't think there's going to be any issue saying, "Oh, sure, take it all." But from a Granville perspective,
Yeah. I know in the last meeting, Matt was saying they had all this money, but they didn't know what to do with it. So I
yeah,
think with the pooling process and having this, we'll call it like the committee for it, which would be our district, having this availability and this partnership with Tapestry would allow a lot of good. And it would
yep,
probably allow Granville to get the money to something that they know it's going to be used in a
yeah,
efficient and hopefully quick manner. Yeah. But it seems like Tapestry would be able to do this quickly, and we could get we could get some good done, honestly, when it comes to the opioid um, crisis. So
all right.
we'll see, but that's a
And
hope.
we I failed to set up a meeting with the town manager in Southwick and police and fire. Was one of those email chains that just fizzled out.
Well, you were sick,
So
so it's
yeah,
okay.
so we have to reignite that effort. But Kayleen and um, when was that? 2 months ago? A while ago, we had a kind of an informal conversation with the town administrator, and she seemed supportive of,
Yeah.
you know, even though we would kind of be I can't think of the word, but obviously Southwick and Granville will be paying in more than the other towns, but she seemed okay with it because
Yeah.
it's kind of
Okay,
good for the greater good for us all to have these resources
Yeah, and the
as a
money is
group.
laying dormant, so
Right, right,
better to use it for something that will be continuously used.
right. So
That's the hope.
so yeah, that's our next step in Southwick is we have to meet with um the town administration and police and fire and make sure they didn't have any other plans or dreams with it. I think fire in Southwick would be happy to have a separate sharps container
Mhm.
because they have one in their lobby, and I think it's a bit of a hassle for them, and
Yeah.
they pay for it out of their budget. So if we could pay for it with the lawsuit money, I think they would be pretty happy. So
And it allows it to be more private for people who maybe are disposing of, some illicit drugs or whatever, sharps that they don't want to go to the police station or the fire station in person. This kind of gives you a private way to dispose safely. So that's another option. So yeah, just wanted to kind of see which towns would be interested in that or
I'll definitely
um
bring it forth. If you could, when you do the meeting minutes,
yeah,
put the cost of the boxes in
yeah,
there so I can talk to that. Our next meeting is we're not meeting tonight. We're meeting next Tuesday.
okay,
So if the meeting minutes are ready, I can bring it before the board then and talk about it.
great. I'll have them done.
How about Jennifer?
Yeah, how does Jennifer, how do you feel about that? Or Tolland?
My concern with Tolland is can somebody tell me what the amount Tolland received? Because last I recall, it was so small that it was like, why do they even bother?
Yeah. I don't know specifically. I don't think in the last meeting we knew how much Tolland got. That was still kind of an unknown. I think I only had Southwick.
Okay, I'll
So
poke through a little bit more, but I just remember seeing it and saying all the time and effort. Is it really worth that little bit of money? It was like
yeah,
nothing.
yeah,
yeah. Even if it doesn't come to pooling, do you think that Tolland would be interested in
I'm
having?
sure. I'm
Okay.
sure. I'm sure. Yeah, I'm sure.
Yeah, because I know some towns are kind of against it, so I wanted to make sure that all of our six were interested in it. So just so
I
that
don't
I
think
can kind of keep the
that's not going to be
communication
an issue.
path straight. Okay, great.
Thank you.
Yeah.
Jennifer back.
Jennifer?
I'll email.
Yeah, we'll have to follow up with.
I'm sorry.
Oh, no worries.
I can barely hear you. Hold on. Ah. Okay, yes.
Just as I was looking back at my email because I had asked Nancy a while back, and it was September. We have about $850 in our.
That's honestly plenty for the things that we want to do, to be
Yep,
honest.
it is.
So
I thought it was a little bit less than that, but yep, it's 850,
yeah,
around 850.
that's great. Jennifer, we were just wondering if Blandford was interested in the Sharps disposal box or a Narcan box outside of either Blandford's town hall or somewhere else.
Not the Sharps. We have a contract with Stericycle and we have 2 locations in Blanford for the
Okay,
Sharps.
great.
For the Narcan, that's a great idea. Yeah.
Okay, great. Good to know. Thank you. All right. Well, that's good, and I'll email Granville.
Yeah, Granville and Montgomery.
Montgomery. Okay.
That brings up a good point, though. Is it in the ongoing? So you said that Tapestry would would take care of the Sharps disposal at a reduced cost, or
No
at no
cost.
cost? No cost.
No
Okay, so
cost.
that may be.
Yeah, that's their main mission is kind of just to go around the community and make sure that all these Sharps disposal boxes are empty and,
Okay.
they're being safely disposed. So from the conversation I had with Marianne and with the director there, they seemed fully on board to partnership with our district and help us with these initiatives, which is awesome.
Cool. All right. Good.
And how long are they willing to do this for free?
They didn't give us any time. Correct me if I'm wrong, Marianne, but I don't believe they gave us any amount of time that they'd be willing to do it for free. I think they really appreciate just maybe having their contact information on the box or something to promote their organization is what I would assume and what I got from the conversation.
Yeah, no, you're right. That's what I understood as well. There was no time limit that we understood. They
Why
just
don't we find that out? If there is a time limit?
Yeah, absolutely.
Yeah, because it might be a cost savings for you to move from Stericycle over to that, depending on whether or how long it is. But I guess the reason why I bring it up is, could that be a cost that's absorbed by um, the district, the public health district,
Yeah.
right, going forward,
Yeah.
rather than each town do it if we go through this.
I think in this case I mean, we'd have to probably run it by DPH, but because it's the opioid funds, I think we could do that.
Mhm.
If it was the grant funds, they would say that it's supplanting the budget and they wouldn't allow that. But because it's money the town received outside of DPH. So if all 6 towns agree, yeah, we want to share this money, I I think it would be legal to save the money and the public health budget, spend it on something else,
Yeah.
and use the lawsuit funds. So,
Yeah, but the lawsuit funds are only short term,
right.
right? At
Yes.
some point, it runs out. So I think that's the question to ask is, ask Tapestry how long they're willing to do it for,
Yeah,
and
absolutely.
then we can make a decision from there. Yeah.
I will follow up with her.
Okay.
Right. I did skip over. We have created a community involvement letter. I skipped over that on accident. Trisha and I created this just kind of gauge community residents' understanding of our health district and that we have public health nurses on staff. And we created it as well to have topics of interest to our community members so that the nurses can do presentations that the people actually want to see and engage with and come to so we can get our numbers up a little bit in attendance. So we have a printed letter that has a QR code link as well as just QR code links posted around the towns. So far, we've had about 40 people respond, which has been great. And we just recently had a staff meeting on Friday, and we are putting it into some local newsletters to hopefully get even more responses. But it's been really helpful for us to understand the topics that our residents want to see. So that's been a plus.
And you said most so far the respondents are Granville?
Granville and Tolland have responded the most to them. So we're trying to get some more in Russell, and Southwick had very few responses.
Did Blanford respond at all?
Blanford, not many either. We had about 3.
So Jennifer, I've got the paper version on the Board of Health table at Town Hall, and I sent to Mary for the Country Journal. So that's going to go out in the Country Journal, I believe, on Thursday.
Okay.
And you said most people don't know that there's a nurse, right?
Yeah.
So far.
Yeah. I'd say about 50% of the residents that have responded have said they weren't aware that they were part of a health district or that there was a public health nurse on staff. So I definitely think if we can get these responses and create programs that the residents want to see and engage with, that would really be beneficial. So the more responses we get, the better. It's okay if people don't know about us, but it's making sure that they do know about us now, and get the involvement increased is our hope. So yeah, that's been good so far. A lot more responses than we anticipated, honestly, in such a short time of it being created. Following that,
just to follow up on that. So the Granville Town Clerk is going to mail that survey in every census.
Yes.
So if you can ask your town clerks to do the same, that would be wonderful. Because they're going to get the census and they're going to get an insert and probably other inserts. So the more we can get out there, the more responses we will get.
Yep. Okay. And we have a letter all created that we can quickly send to town clerks as well. I know census are probably going out or have already gone out.
Starting to.
So that's the hope. The next thing was town bulletin boards, just making sure that those are being put up. I know we bought those with last year's funds. I know some towns were doing renovations, so I know that process is probably a bit slower, but just making sure that those go up soon and that one key stays with your town, whoever's in charge of running it, and one of our nurses get one of the keys to make sure that they can add, especially when we're creating these new programs from the community involvement letter. We want to make sure that people can see it and attend these meetings or programs if they want to. So just making sure that one of those keys is with either Trisha or Marianne would be very helpful. But I know some towns are still renovating and don't have them up yet, and that's okay. But the hope is soon.
Ours is being done at the transfer station. And of course, we have the renovations going on. However, that area is always locked. Marianne would not be able to get into it unless she comes on a Saturday morning or a Tuesday night.
Yeah, we can figure that out. It's a similar situation in Russell. So my contact person, so Nancy, at the Russell Town Hall, I give her the materials and she swaps them out for me. So I'm sure I can work with someone in Blanford to figure that out.
Okay. Sounds good.
Thank you.
Where does Southwick have theirs?
It's downstairs.
It's downstairs.
And Trisha has that usually filled.
Okay.
It's filled right now. Script. Yeah, so that's all I have to say about the bulletin boards. The last part is part of our work plan for the year. It's a big ask, and I know it's probably going to come with a lot of questions. We have another meeting for it coming up in January, so I don't have a ton of answers about it yet, but hopefully I will soon. But it is the Foundational Public Health Shared Service review happening through the state. It is going to be through the local Board of Health and the OLRH. This Office of Local Regional Health. So they are doing a review of each of our towns within our district to review current services and shared services of resources to identify needs and gaps within our district's communities. So a data collection will occur in 2 parts. So there'll be a cost tool and a service delivery tool. And as a shared service coordinator, I'll be guiding the discussions through it, the analysis, and the planning of it. But each of our towns, either the health directors, board of health members, or select board members, will be responsible for completing the review. So they'll be gathering information. So the cost part of it is what's going to be first. This is going to run through January through May. So the first part of the review is going to be the cost, which they will be sending hopefully within the next couple of weeks. I think their hope is mid-January. Each of the towns is going to get an Excel spreadsheet through Smartsheet, I believe will be the platform they'll be using. So each community will have their own tab within our district, and they'll collect information on resources and labor and revenue and contracts. And this is a lot, but it's gonna everywhere from grants, permit fees, labor, salaries, operational costs, contracts, any revenue the town gets to fulfill public health services will have to be documented. And then the second part of the delivery tool is service delivery. So it's again going to be through an Excel sheet, and each community will have their own tab, and it will ask certain questions, and each town will have to answer the time spent to perform certain public health services and how long and the expertise they have to perform them. And that's what I know so far. So there's only been one meeting, and it was very broad, and there was a lot of information, and it came with a lot of questions from the shared service coordinators and other towns and health directors. It was a lot. So
this is a requirement because of the grant.
It's a requirement. They're trying to do it in the entire state, but right now it is a requirement through the grant that every town in each shared service agreement has to complete. So it's going to be a bit of a headache, but hopefully they're going through some changes and some tweaks with it right now. So hopefully in mid-January, they will be able to answer more of our questions. And as a shared service coordinator, I'll be able to learn more about it and have the ability to answer more questions. Along with the service delivery tool of it, I think a lot of our shared staff within the shared service agreement, so either myself, Trisha, or Marianne, will be able to answer a lot of the questions, because I know a lot of the towns won't know the answers to many of these questions, but hopefully when it comes to the cost part of things, that will be easy to fill out.
What do you mean cost? How much it costs for us to do this?
The cost meaning like how much, so for Tom, for instance, in Southwick, he'll have to go through his budget of how much the town made in permits and fees, how much the salaries were, operational cost, contracts. It's a lot. I won't lie.
That's awful.
Yes. Hopefully in January, they wanted us to introduce it as soon as possible. We had a meeting about it a couple weeks ago, so they wanted us to talk about it in our next meeting. So that's why I'm bringing it up. I apologize that I don't have more information on it. I wish I did before bringing it to you all. But the hope is that mid-January, we'll have another meeting with the state. And then for our upcoming meeting, February 10th, I believe, February 11th will be our next meeting. I'll be able to really start the process. But they should be sending us our link to our smart sheet with the Excel sheet soon. I'm hoping beginning of January.
And once they have all this data, what are they going to do with it?
They assess how much of our services are being shared within our district. They assess how much money each of us is making and bringing in or taking home. And they assess if it's enough for the services we're providing. So the hope is this will bring us more money. I think it will, because we're not doing, we don't have the capability to do as much as I think the state always wants us to do. But if we had some more money, I think we could do a lot more. Trisha and I always kind of say this. We always feel we had more because there's so much that we want to do. And so much that we think we could do if there was just more in our budget. So that's the hope, is that we go through this review and it's beneficial to us, which is really the only way I can make this look better, is that at the end of it, we'll have more money.
Yeah. And I think there's some legislative backing to that too.
Yeah.
If you haven't all heard, there is the SAFE bill, SAFE 2.0. They did the first one was in like 21, maybe 2020. And that is what created the framework for creating all these shared service arrangements. So the state, they've been trying to pass the follow-up, the Safe 2.0 for like a year and a half now. And it was attached to the economic development bill and supposedly was signed by the governor today.
Yes.
So there is the legislature passed it, I think, a week or two ago. Um, so there is significant funding coming the way of local public health from the state. So along with that funding is a lot of, you know, requirements, and they want the ultimate goal. They want all the towns to be more consistent, which is it's a noble goal. You know, there's definite stories you hear about people going to different towns and they do things completely different from the town next door. So the goal is to make it so wherever anyone lives in the state, what they're getting for public health services is comparable at least.
Yeah.
So
Consistent.
yeah, so it's
Consistent.
a worthy goal, but it's going to be a lot of work for us.
Yes. And it's a lot of questions on the foundational public health, which ranges anywhere from equity and diversity means, sorry, diversion. Emergency preparedness. So like in the case of a pandemic, again, hopefully not, but policy development as well as chronic disease management. Anything that we really do here, they just want to expand and make sure that the services are shared and equitable. So that's their big thing. And the big focus for us. So hopefully it'll be smooth, but we'll see. Is there any questions on that? I know it's kind of broad right now. Hopefully there'll be some more updates to come following our next meeting. Hopefully Tom will be able to attend that with me so that there'll be two listeners on, because it's a lot. It was a lot the last meeting, so apologies if it's not very clear right now. Any questions though? Okay. I don't have any new business to cover from the actual agenda. So our next meeting will be on February 11th at 2:30. Yeah, is there any other questions that anyone wants to bring up?
I'm good. Thank you.
Yeah. Anyone want to make a motion to adjourn?
I'll
I
make a
make a
motion.
motion. Oh, go ahead.
No, go ahead.
I make a motion. We adjourn at what's it? 3:13.
Second it.
Great. Thank you so much, everyone.
All right.